Call the meeting to order. It's August 1st, 2016, a little after 9. Let's all rise for the pledge, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everybody. Roll call, please.
Ms. Reagan.
Present.
Mr. King. Here. Mr. Henry.
Here.
Mr. Brook.
Present.
Thank you. We have a public hearing for application for assignment of tax sales certificates to a nonprofit corporation, Greater Muncie, Indiana Habitat for Humanity, 1621 South Jefferson Street and 322 East 9th Street in Muncie. Is anyone here for that?
I'm Kelly Kern with Muncie Habitat. We, for over a year now, have been working in South Central and Thomas Park, Avondale neighborhoods, working with residents, community organizations, schools, churches to do a neighborhood revitalization program. We have a plan that we have developed. We have a coalition that's working the plan to develop pocket parks, community gardens, community orchards, improved housing, all kinds of improvements to the neighborhoods and the assets that are already in those neighborhoods. And so these two lots we are interested in obtaining these for neighborhood revitalization and making improvements to the neighborhood.
So are you saying these lots will, are they empty right now, or are there some houses on there yet?
They're empty, and we're looking most likely at pocket parks for both of these lots, where we have minimal playground equipment, some picnic tables, maybe a couple benches, maybe a tire swing for the neighbors and residents to enjoy.
You're working with our local Lowe's store?
Yes, actually a lot of the funding for the improvements going on, we received a $70,000 grant from Lowe's Corporate. We were one of 19 habitats across the country that were awarded funding for this type of work. So we actually had a big group a couple weekends ago. Lowe's brought nearly 50 people, employees, to come out and volunteer and work in the neighborhood. So they're putting their people where their money is.
Sure.
That's great.
And even though I am disappointed that a house is not going to be built, but you're going to be improving the sidewalks, which I know many of those sidewalks down there need replaced probably.
Yes, we do have plans later this year for a new construction home on 9th Street, 9th and Elm. So housing is certainly, top priority as part of this plan, but not necessarily for these two
And we do need
lots.
recreation for the children, so very good. Thank you.
Is there anyone else here to speak for or against this?
Make a motion to close the public hearing.
Second.
Roll call.
Thank you,
Mr.
Kelly.
King.
Yes.
Ms. Reagan.
Yes.
Mr. Henry.
Yes. Thank you. Appointments, Muncie Public Library Board.
Beth, you want to speak on behalf of Mrs. Stone?
I'm Beth Craylow, the Assistant Director of the Muncie Public Library Board, and Daniel Stallings is asked to be reappointed to the board. He was filling out a term. He is currently the President of the board.
No, whatever Mr. Stallings does, he does it well. If you can please. I move that we appoint Daniel Stallings to his full 4-year term.
Second.
So I have a motion and a second. Roll call, please.
Ms. Reagan.
Yes,
Mr. King.
Yes.
Mr. Henry.
Yes.
thank you, Ben.
Thank you. Table items. Any action on those?
Good morning, Ed Canasser, FC Tucker. I just wanted to come to the meeting this morning to see if what the current status was with this opportunity and to answer any questions that you might have.
Ed, have they told you what timeline when they are going to be needing this property?
We were ready back in March to start the process. It was contingent upon the commissioner's approval of this letter of intent. And then the two appraisals would have taken place. And so we're still prepared to follow through with that.
What are you gonna do with the parking lot?
I'm sorry, I don't know. I believe the original intent was to use that old jury parking lot for some staging areas. But I haven't had any conversation as far as updates on what their potential use is.
Wasn't Mr. Smith one supposed to attend one meeting to explain
I'm
the
not
purpose for the parking lot?
I'm not sure if that's a need. I'm happy to try to get him here at the next meeting.
And you guys still don't own the parking lot that you guys want?
Now that as you look at the LOI, it's
I know you
contingent.
guys want us to sign this and then you'll purchase the property, correct?
Get two appraisals and then go ahead and close on that and then exchange with you on the old jury parking lot.
I'd just like to have more information on what you want to use the parking lot for.
Could you have Bill come to the next meeting?
I'll request that, sure.
Okay.
With everything going on, I'd like to have more information.
Okay.
Very good, thank you.
Thank
Thanks,
you.
Ed.
Mr. King?
Mike King, Delaware County Clerk. You have an item on there for Microvote's contract. We've resolved our issues with Microvote on their certification, so I'd ask that you untable and go ahead and pass their contract if you would.
Is it to be passed with the same amounts as before?
The amounts didn't change. We had to wait on them to be recertified by the state. There was a change in the state code concerning the at-large candidates and where they were placed and some of the wording and whether or not the machines, not so much the machines that are used at the polling sites, but those used for the paper ballots for the absentees, and make sure that they got certified and that they worked properly, and that has been done. So that's what we were waiting on. So the amounts outlined in the contract and everything else are still accurate.
Mr. Brook, you reviewed the contract?
I reviewed the statements, yes, and saw the amounts.
You guys like to do?
Well, if they're happy with it, I guess I'll move that we adopt as presented.
These are for the polling sites.
That's the amounts that we pay them to help us run the elections with their service contracts, as far as them coming in and cleaning up the machines, making sure they work. We've used them for many years without incident. They take care of our machines. They come in and clean them. They run diagnostics on them, all of that, to make sure that they stay up and running. Our machines are actually have been well beyond their life expectancy because of that. So they do an awesome job for us. We just had to wait for the state to say that they got their certification passed. So that's,
They handle the absentee cards and all that.
yeah, they come in, they're on site with us for poll worker training, and then they're here actually the night before the election and then all day during the election to help any situations we have at the polling site, and then they run all of the absentee cards after the election group checks the signatures.
Well, this does bring up a point. If we were to sign this and then have to buy some new machines, would we just buy new ones or? from
Yeah, and
them?
our machines are fine. What we have, and that's what I'll get into in the budget process with the council, is we have to do an update, and I've asked for those funds next year, since it is an off year, hopefully, that we can purchase the software upgrades on the machines. So that's outside of this. Our machines are still good, they just
Just the
replace the
software.
guts on the
Okay.
inside, yeah.
Okay, very good.
I'll second it.
Okay, we have a motion and a second to accept this 3-year service contract. Roll call, please.
Mr. King. Yes. Ms. Reagan.
Yes.
Mr. Henry.
Yes.
All right, thank you.
Thank
Thank
you,
you.
Mr. King. Approval of the minutes for July 18th, 2016.
Motion to approve.
Second.
Roll call, please.
Ms. Reagan,
Yes.
Mr. King,
Yes.
Mr. Henry.
Yes. Approval of minutes for the July 19, 2016 Commissioners' Special Grievance Hearing meeting.
So moved.
Second.
Roll call, please.
Ms. Reagan,
Yes.
Mr. King,
Yes.
Mr. Henry.
Yes. We have a presentation to the Commissioners. Apex.
Good morning, Commissioners. This morning I have Eric Dreyfus and Rebecca Lehman from Apex Benefits here to give you a brief overview of the first 6 months of our new health plan and kind of show you where we're going from here. So,
Thank you. You have a folder from Apex that Pam placed before you before the meeting. And within the folder, there's a bound presentation. This is simply where we were for 1/1/2016. And if you look at page 3 of that presentation, you'll see your year-to-year claims from 2014, 2015, and then so far year-to-date 2016. It breaks out your medical claim spend, your RX claim spend, and your enrollment, and then totals that. So you'll see if you follow that down, there's a total line about halfway down that page. Last year, your total claim spend was just over $5 million. So far this year, through 6 months of experience, you're at $1.6 million. So you'll see the savings from the program that you've moved to illustrated here, and then also in another financial report that I'll talk about in just a second. The plan overall is running well. The next 2 pages show large claimants. In 2015, you had 2 claimants that did meet the specific deductible level, just barely. One was $14,813 over, and one was $200 over the deductible of $200,000. This year, you have no one who's reached that level year to date. So again, another indicator that the plan is running very well. On page 6, you'll see projected future trend for claims. So we're starting to look at your renewal for January of 2017 and where we expect reinsurers to price and estimate your claims, what that underwriting process will look like. So we take a rolling 12 months of claims experience and we trend that forward. So right now you're in a little bit of an unusual situation because you still have 6 months of Anthem claims, 6 months of GPA claims that are blended together that are rolling into this projection. So it's a little bit high. You're trending down this year compared to last year, but when underwriters are looking at your plan overall, it still has that higher component because you don't have a full 12 months of experience yet. So that will continue to go down as we see more experience under the new program. And we'll see that play out between now and even when we come back to present the formal renewal. Any questions about any of those claims numbers?
Appreciate the good news.
I love to bring good news.
Yeah.
The next few pages just go through your admin fee renewal. We've put in some illustrative examples at this point in time. We will firm those up again as all of the renewal numbers come back from the reinsurance carriers for 2017. So right now, if you look at the bottom of page 8, we're looking at, and these are just plugged in again, so it's just an estimate at this point in time, a 9% decrease over where you started out this year. That might be even greater if you continue trending the way that you are. Of course, I can't predict what your claim spend is going to be month to month, but so far this year it's been really good. And page 9 kind of totals all of that. It totals your fixed costs, your expected claims costs together. So you're looking at a 7.6% possible decrease. Again, this is an estimate based on where we are today. The next few pages I'm not going to go through in detail, but we did move dental to Delta Dental in January of 2016 and vision coverage to VSP. Both of those are in rate guarantees, so they're not up for renewal this year. Your life and disability coverage with One America, we initially moved short-term disability and it was advised to pay through GPA, but effective June 1st, we moved it to One America, and that allowed the short-term disability and the long-term disability to kind of mesh together in a way that it hadn't previously. But they've also agreed to a rate guarantee until January of 2019. So those won't be up for renewal this year at all. The only thing that we'll be looking at for your renewal will be your reinsurance costs and your medical as far as lines of coverage go. Okay? On the left-hand side of your folder, I have some financials that we prepare at Apex, and we look at these to see how your plan is running. The first page of those financials shows both of the plans combined together, 2016 year-to-date experience. And so you'll see the enrollment broken out by tier, so employee, employee spouse, employee, child, and family with total numbers, your total member count of all the participants in the plan. Then the next few columns go through your medical paid claims, your prescription drug paid claims. If you had any spec hits and were reimbursed for that, we would account for that in that column C. And then we net out those first three columns in column D. So you'll see in January a pretty high number, February it drops down. That's mostly run out from Anthem. That's why it looks that way, because those are the Anthem claims that were incurred in 2015 but not paid until January of 2016. So then the GPA claims really started coming through in March of 2016. Column E has your fixed costs. So adding up your net paid claims and your fixed costs together, you get column F. And then we also track your employee contributions month by month. And we track all of that against premium equivalents. So this report is color coded. If you look at your premium equivalent so far for 6 months, you're just over $3 million in that green box, and we take that down to the middle. If you look at your total paid, you're at 1.9 million, just under 2 million there. And so you're running under where we expected you to be by just over $1 million at this point in time. So again, another indicator that the plan is running really well. That is a lot, it has a lot to do with moving to the program that you're on, but it also means you're having a really good year. So both of those working together in your favor at this point are really good. Over on the left, we'll track that from year to year. So if you look at the first 6 months of 2015 compared to the first 6 months of 2017, you're down about 33-34% in cost from where you were last year. Over on the right, in the peachish, orangish colored box, the clinic so far year to date is at $208,000. And then the Delameds program, these are just the first quarter numbers, are $54,000. So we don't have the second quarter built in there yet, but we'll get that in there. The next 2 pages are the same exact report, but it just breaks it out by plan. So page 2 is the PPO plan, and you'll see it's running well under expected. Page 3 is the HSA plan, and it's running over. What I found interesting is that I think we'll see that change a little bit over the course of the next few months. But if the next pages 4, 5, and 6 are the same exact report for 2015. So we put your 2015 financials together to be able to compare accurately 2016 numbers to 2015. And so you were just a little bit under your expected overall for 2015. But the plans were running a little bit opposite of how they're running now. So your PPO plan was actually running right at expected, and your HSA plan ended up about $274,000 under expected. So they flipped up a little bit from 15 to 16. So that's something that we'll keep an eye on. Any questions about that?
That's a lot of numbers to look at, but we appreciate it.
It is, and I talk about them every day, and sometimes it can be a foreign language, so just stop me if you have questions at
And
any
you
point in
might know
time.
this question, might want to ask, and Rick might want to address it. But Rick, what % of our employees are using the clinic? Are we getting up there good average?
I don't know if you have that number.
I don't have it with me, but I can get
We're
that.
still low. Well, now, with the three groups that are in it, you know, the city and the schools, we're ahead of them.
Oh, good.
But we're all still low. We need to still push clinic usage.
Yeah.
So, and it's a great deal.
And the evening hours, I know, are a big plus. They did drop Saturday, right?
Yeah.
A year ago or so. But the evening hours, I think they picked up for the.
They're awful easy to get into.
Yeah. Well, thank you very much for the presentation
Thank
and the
you.
good news.
I do have 3 other things just to mention briefly. RX Help Centers is a program that I think Rick may have spoken to you about previously. And we did an analysis when we first came on board with Delaware County. And it's basically a program that takes all of the manufacturer's discounts for prescription drugs. So, you know, on the commercials for a prescription drug, it'll talk about if you can't afford this drug, call the manufacturer, and there might be a program available for that. RX Help Centers takes all of those and combines them under one umbrella. And then they have also partnered with philanthropists that need to basically give away money for tax purposes. And so they set up grants for prescription drugs as well. And so it's a program that has a pretty significant savings potential for the county. It's based on utilization. There is a fee for the program. It's $50 per enrolled member per month. And we can run updated numbers for you if that's something that you're interested in. But it's something that I would recommend for 2017 to help offset the cost of high prescription drugs. When we ran the savings previously, Delameds was already in place. So it's not something that would necessarily replace Delameds, but it would work alongside Delameds, if that makes sense at all. When we ran savings, I think they were in the fall of last year, so it would have been the Express Scripts contract under Anthem, and it was showing about $400,000 in potential savings. Again, that's based on utilization, so it means that employees would need to utilize the program in order to see those savings. And part of those savings would be for the employee spend, for those on the high deductible health plan that are paying 100% of their prescription drug cost until their deductible's met. And then part of it would be county spend as well.
Well, that'd be interesting if you can get those numbers to us.
Sure.
And what's the timeline, when would we?
I would recommend implementing that for 1/1, and we would talk about it during open enrollment, because employee education is a big piece of that.
So they would have to really participate.
Yes. 1-800-MD is a partnership that Apex has formed within the last year. So it's just something that I want you to be aware of. On the agenda on the right-hand side, if you pull that out under the 1-800-MD section, it talks about the cost for the program. But this is another way, in addition to the clinic, to help save cost for primary care that can be utilized over the phone. So this, the 2 pages on the left-hand side, you have a brochure. This is really a trifold brochure, but I just left it as 1 page. And then you have a second flyer from 1-800-MD that just talks about how the program works. But basically, in the top left-hand section, all of the conditions there can be treated through 1-800-MD. As the county would have the flexibility to decide what the cost is for an employee when they call in and utilize the service. And I outlined that on the agenda. So it can go from free for the employees, and it would cost the county $3.50 PEPM for the program, or it could go all the way up to $38 per consult, and it would be $2 PEPM. So the program is a 2-year agreement. It pays for itself because it's not just primary care. If you estimate the cost of a primary care visit outside of the clinic at $75 to $100, but then also think about urgent care and ER visits, you're going to save by implementing this program, and you're going to give employees more access to care outside of hours that even the clinic isn't open, so that they don't have to go to the urgent care or to the emergency room. So something else to think about. And then the third thing, in meeting with the clinic, we talked about looking at a wellness program. And I think with some of the savings that you'll see, by moving to this cost-plus arrangement, this would be something that I would recommend that we start working on maybe in 2017 to roll out maybe this time of year in 2017 or in the fall, to look at implementing some sort of wellness program to catch medical diagnoses earlier and to see, it would also help, I think, with increased utilization of the clinic, because the clinic would be handling the wellness program. So there's an option for them to come on site and perform screenings, or people to go to the clinic and perform screenings. But it's something else that would be a recommendation from Apex going forward to look at in the future.
I've often wondered if we're missing it by not being more on-site, because just getting people to take time to go somewhere, we can make it easy here.
Yeah,
And at all 3 or 4 sites that we have.
Yes, that's what we talked about, and if you look at the very back, page 7, they ran costs both ways, with screenings at the clinic and with screenings on site at Delaware County locations.
I'm sorry, I lost what page that was.
It's the very back page, page 7
Of this.
of this wellness proposal from InHealth.
Yeah, that's only got 6. I'm blue, I don't remember seeing it. Thank you. Yeah, I'm very impressed with that. Anyway,
So
thank you.
for everything included, that $9 PPM to come on site is really a
Yeah.
very competitive cost for that. And it integrates with all of the other data that the clinic already has, and provides you with an analytic component to be able to dig into your claims in a little more detail and see what's going on and target programs specifically toward hypertension, obesity,
Yeah.
and tobacco cessation from that. Okay,
Well, thank you.
that's all I have.
Thank you.
Shannon?
Jeff Arnold, Delaware County Prosecutor. I'm going to have Rick explain how this works because I have no idea, but wanted to tell you a little quick story about how good a service Rick and whoever our insurance are provide. I've been trying to schedule a surgical procedure for pain for about 6 weeks. I kept calling in, and I was being told, well, your insurance company just hasn't approved it yet. I called back about 2 weeks later, well, your insurance company hasn't approved it yet. So I called Rick on a Friday, and he was had that day off, and I said, well, I'll just call you back on Monday, no big deal. Well, Monday, a girl named Lori, right, first thing in the morning, Monday morning, a girl named Lori calls me and says, I've talked to your doctor's office. This doesn't need to be approved, but it's all approved, set up, you can go in and schedule it. So I call the doctor's office, I say, I understand this procedure's been approved, and they said, well, no, we just can't seem to talk to anybody from your insurance company. We keep leaving messages, but they're not returning our calls, so we'll call you back. So about 2 or 3 days later, I went into their office and asked for the girl, and they said, well, she doesn't see people, but you can call her. I explained to them how that wasn't going to work for me, and that I wasn't going to leave the office. She finally came out, said, what's going on? Got the same story and said, well, how about if I try? And she said, well, you're just going to have to sit and wait until they call me back because I've left messages. And I said, no, let me try. I had Lori's number. I call her. She answers on the first ring. I tell her who I am. She remembers me. I tell her what I'm doing, and she goes, let me talk to them. I let them talk to them. The girl talks for about 15 minutes, stuttering in front of everybody. Finally hands me back the phone and says, how about Thursday? So talk about good service. Not only from Rick did he remember that when he was gone, but for first thing on Monday, I got a call back from Lori. I don't know who Lori is. I don't know who she represents, but she sure did help me. Just wanted to let you know that. And I think that she's connected with
these people send me. I don't know. It is kind of a puzzle how it's all put together. Lori works for GPA, and Lori and Rebecca are two of my really go-to people on these things, and they really make it happen. The big component to this system that makes it work is the employee or our insured has to get involved. Get involved in your own health care, be a good purchaser of health care, and this thing will really work for the county and for us. So I'm glad Jeff could tell the story, and yeah, it takes a little bit more time on the people's part, but we're going to see some numbers here that you guys are really going to like, and this is a very good system. Thank you.
Thank you,
Thanks.
Rick.
All right, we'll move down to contracts for agreements for approval. An agreement between BI Incorporated and Delaware County Juvenile Probation, agreement number 061516CW1.
I've had an opportunity to take a look at these agreements, and I don't see any problem with them.
Okay.
Make a motion to accept.
If he's approving them, I don't have anything to say. Okay.
Okay, we got a
Second that.
motion and a second to approve.
Put them together.
You want to put them both together?
Yeah, I'll
Three
make a
of them.
motion.
Is there another one?
Yeah, on the other page.
All right.
To approve all three BI contracts.
Okay, got approval for all three BI Incorporated contracts. Got a second?
Second again.
Roll call, please.
Ms. Reagan,
Yes.
Mr. King,
Yes.
Mr. Henry.
Yes. Thank you. We have a resolution for approval. Denise, what's the number for that? I know you sent it to me. but-
That's okay. 2016-041.
Resolution number 2016-41, resolution of the Board of Commissioners of the County of Delaware, Indiana, making a final determination on tax sales certificate to be assigned to a nonprofit corporation number 9.
So move.
Second.
Roll call, please.
Mr. King,
Yes.
Ms. Reagan,
Yes.
Mr. Henry.
Yes. Department heads are elected officials. The decision of the Delaware County Commissioners in reference to the grievance filed.
This is for the grievance filed under the collective bargaining agreement with the Emergency Center 911 employees. The grievance that we heard at the hearing on the 19th. The contract requires a written finding, so I created some written findings for your approval.
I'll make a motion to approve.
Second.
Motion to approve, and we have a second. Roll call, please.
Ms. Reagan,
Yes.
Mr. King,
Yes.
Mr. Henry.
Yes. Thank you, John.
And I'll send a copy of those to the 911 director and to the union president as well.
Thanks, John.
We have the weights and measures report. I'm sorry, Jason.
Go ahead.
We're just making a note that we do have that in our file. Go ahead, Jason, I'm sorry.
Good morning, Commissioners. Jason Rogers, Emergency Management Director. I've got a few things for you this morning. One is the EMS write-offs for the month-end report of June 2016. Write-off amount is $403,208.47.
Make a motion to accept the write-offs.
Second.
We have a motion and a second. Roll call, please.
Mr. King.
Yes.
Ms. Reagan.
Yes.
Mr. Henry.
Yes.
A few other things just to call to your attention. We've been pretty successful lately, or at least this summer, with some grant applications. We received 3 specific grants from Indiana Department of Homeland Security, two grants, and then the third was from the Firehouse Subs Foundation. The Homeland Security grants, one was $13,000 for a on-scene communication project. There was a $4,000 grant for CBRN hazmat equipment. And then the $14,000 grant was a partnership between Firehouse Subs and Ironman, who obviously has been in this community for many years. we received a $14,000 grant for a Lucas device, which is a CPR machine. The notable thing about this particular piece of equipment is, obviously, this is a private grant, so it works a little bit differently. They just sent us a check. We purchased, before the official award, we purchased the Lucas device, and by the time, I think it was 6 weeks, by the time we had received the big check at the Ironman Village, this particular device had made a difference in 5 people's lives. It's an automatic external compression machine. We are amazed at what this has been able to do. We looked at the research and kind of looked at some grant projects, but I'm going to have to say in probably the last 5 years that this thing is probably the best money we've spent, and made a huge difference, obviously. So probably into 2017, we're going to look at maybe trying to outfit the rest of the trucks with this particular. We've got one. It goes on every cardiac arrest that we can get it to, and so that's almost daily. And we're very, very happy with that. So I just wanted to report that to you. The other thing is we have 2 open grants with IDHS for fiscal year 2016. One is an open grant which is a State Homeland Security project, and one is our Emergency Management Performance Grant. And I'll have information later to report on those. The final thing that I have for you this morning is a bit of a frustration for EMS. We are currently undergoing a review of Medicaid billing processes over the last 7 years. I'm going to call it an audit because that's exactly what it is. And the state has looked at doing a different way. They have actually hired actuaries, certified public accountants to go through and look for the most minute issues for us to be able to, or for them to be able to say that we are not complying. Obviously, you're aware of this because we've been working on it for some time. We are turning in 2 banker's boxes, which is 160 cases today, with our rebuttals to those, every single case. Mr. Brook has been instrumental in putting some verbiage together for us to explain our position and why they don't understand the medical side of what they're trying to audit. The one thing that I want to call your attention is we've been very active looking into Senate Bill 364. I testified on July 11th in Indianapolis, and we attended the open hearings on July 18th in Mishawaka. And I'll be sending you some more information on this Senate bill. The long or the short of this story is I think there's some people writing some legislation that don't understand how this necessarily works from a municipality's end. They gave us 7 minutes to talk over cases for 7 years, and it's very frustrating. So I will be reaching out to you and probably request a formal letter to submit to this hearing. So I appreciate your time. Thank you.
Jason, are we the only one that they're kind of giving a hard time to? Or?
Oh, no. Just as an example, it's not just EMS. It's the medical field all the way across the board. Very quickly, I can tell you, there were, at the Indianapolis hearing, there were probably 40 other practitioners that were there. There were specifically, the hardest hit people were dentists. And the very first lady, and it just goes to show you kind of the mentality of this auditing firm and the FSSA office. This lady was a Sagamore of the Wabash. She has treated underprivileged children, given them dental care for 40-some years. She, over this 7-year period, when they audit you, they don't say, well, you overbilled by $20. What they're saying, and you owe us that $20 back. What they're saying is, you overbilled by $20. Your total reimbursement was $5,000. We want the $5,000 back. This lady was an absolute saint, and they were very cold and cut her off. They want $4 million back from this lady. She is somebody's grandmother. She told them, she goes, you'll kill my retirement. I'll have to sell my home. I'll be in bankruptcy after all this work for these underprivileged people. So there's a huge frustration There were several other practitioners that spoke. There was a surgeon, there were oral surgeon, there was a dentist, there were some other physicians there. We were the only public entity that got up and spoke. And from what our audit says, compared to these other people, we're dropping a bucket. But the frustration is true and it's really there. So we're going to try to lead the charge for getting this information back out. I know that through Mr. Brook, we've worked with some other EMS agencies that have undergone the same thing, and we're appealing this and intend to, take it as far as we possibly can, because this is absolutely ridiculous what they're trying to do. I told them in our hearing, if I could just stop billing Medicaid patients, I would do that, but that's not allowed. If I didn't have to take Medicaid patients to the hospital, I would do that. That's not allowed. This isn't, because this has nothing to do with the patients, other than many of them will abuse the system that we can't bill for, but that's not the point. The point is they want to look at the finite issues of you didn't have the correct mileage, or you didn't take the most direct route to the hospital. Well, they don't care if there's a train in the way. They don't care if there's issues with road construction, and God knows they have it here. So there are just a plethora of issues, from documentation to using actuaries to do this work. So like I said, I'll be reaching out to you in more detail and before we move forward with this. Thank you.
The most telling thing is that these auditors are getting paid by the amount of money that gets returned to the state.
That might have something.
And the other point, here's the really interesting thing, is the contract with Blue & Company that we've been getting Medicaid money and Medicare money back with. When Blue & Company prepares the information for us, guess who they turn it into? So we have received money over the last 3 years, and now they want it back in, threefold. So there's a lot. I brought up some ethical issues with the way that they're running the contract. They would not speak to me during that 7 minutes. They won't answer questions. They look at you very stone-faced, and it seemed very much like they're doing 3 hearings. They just got to get them out of the way for this working group. So very frustrating.
Yeah. And good luck on that.
Thank you.
Thanks, Jason.
That's terrible.
Any other department heads or elected officials? We have a payment of claims of $2,199,142.10.
So moved.
Second.
Roll call, please.
Mr. Reagan.
Yes.
Mr. King.
Yes.
Mr. Henry.
Yes. Any other questions from anyone else?
Do you want to do the weights and measures report? Oh, I'm sorry. I missed that.
Ed can answer, O.C. Tucker. I was able to capture Mr. Smith if the board's willing to listen to him while he'd like to speak.
Okay.
Thanks.
Yeah.
Did you all say yes?
Yes.
Good morning, Commissioners.
morning.
Thank you for seeing me here this morning. First of all, before I get into this particular deal, I'd like to say thank you to the Commissioners. You've been very cooperative with the sanitary district. The district has no intent of buying any property. However, we're being forced into doing that to save money. Previously, a board signed a $160 million long-term control plan, and we're working diligently not to spend that much money, because the rates of the sanitary district are going to go up enormously if we continue to go along with that plan. So we've had numerous meetings with the IDEM, and we're hoping to get that reduced significantly by putting holding ponds and different apparatuses into the neighborhoods rather than do this complete sewer separation. So the Commissioners, and really what I'm really here to say on this particular instance is thank you so much on the tax sales. You've been very lenient in getting the properties to us that we needed for those help reduce the rates of the sanitary district. So thank you. Next thing, when I bought the health department building you're renting now over in Mulberry and Washington, 2 lots came with that. They were on Washington Street. One of them I sold to the Commissioners at that point. I think you're using it. There's an adjacent lot next to that. So it seemed that having 2 of those lots together, and by the way, I sold them both for $30,000. I sold one to a private individual for $30,000. I sold the county that lot for $30,000, which I think were appraised for more than that. We have then, the sanitary district have dealt with the commissioners before on this particular lot over that you own, I'm not sure what you're using it for at this point in time. What's that address? Ed?
Would be the 300 block of West
300 block of West Washington.
Yeah, yes, thank you very much. So, but bottom line is what we're trying to do is, the district has used that lot in the past for construction purposes. We store pipes there, wherever the case may be, when we're doing work downtown. And it's centrally located to what we're going to be doing. We've put the main trucks in for the storm work downtown, but we have to do all the neighborhoods also. So what seemed like a pretty good idea at the time was if we could swap lots. If you could have the lot down on Washington Street, which gives you two lots together, we would be able to use this lot for storage of pipes at this point in time, and who knows for what in the future. So, it's not a very large issue for us. It just seemed to make sense to everybody. So I've asked Mr. Knatzer to present it to the board and the commissioners and see if that'd be something you want to consider. That's the bottom line, basically, unless there's any questions of why we were looking for that lot and why we thought that it makes sense to swap the two lots. So.
This lot sort of sets adjacent also to what you guys call your canal district.
That's correct.
So you're going to set pipes and stuff up next to, I know what the mayor and a lot of people talk about, this canal district that we have.
That's correct, but not only that, we're doing storm work, and we're going to be doing in the east end, basically the entire downtown. We've got the main trunk. In other words, we couldn't have opened the hotel at this point in time because the old Horizon Center actually had stormwater going into their basement, and so did the Radisson. So, but the main, what we've accomplished at this point in time was we've corrected that, and we've corrected so we can put a new hotel in there and take care of the stormwater. We're now going to be moving into the outside neighborhoods that are adjacent to downtown and doing more work. So basically, that's what we're going to be doing.
So it's going to just be a storage.
Basically,
More
at
or
this point in
less,
time,
it's
that's
gonna
our
be
plan to
storage.
report. At this point in time, that is the intent of what to use it for.
And you guys, the other lot that you're talking about, the one at 214 East Washington Street, you guys don't own that property, correct?
No, we have it, and I'm not sure it's gotten assigned yet, but we've had 3 verbal agreements for them to sell it back to us for $30,000. And we could, it's either the sanitary district would pay that $30,000, we would switch lots, and that's how we would do it. All this is based on getting 2 appraisals of the lot. We're going to pay at least the middle of it, and but I feel very confident that $30,000 for either one of those lots is not exorbitant prices. And again, if you don't, you have all the information, you talk about it, think about it, and this isn't something that's,
You don't know how much the person that you guys are going to be buying this lot off of paid for prior to you guys?
Yeah, he bought it from me for $30,000.
They bought it from you for $30,000?
Yes, sir, yeah. So he's actually selling it at no profit at this point in time. He thought I guess he put some apartment buildings down there, and he thought he needed that parking, because it's right across the street. He doesn't need it at this point in time.
He recently sold that.
Who's parking in that lot now? Do we know?
I don't think anybody,
Only as tenants.
His tenants are parking in the lot?
On Jefferson Street.
Yeah, probably the guy that he sold it.
when I went by there, it was completely empty I think, I saw a truck in there from one of the nonprofit organizations, but I don't check it out daily. But again, what he is saying is that he bought it because he thought he would need it for additional parking, but he doesn't. So then this would all be contingent upon us getting an agreement with them, him actually signed, and then coming back, and we'll give you a copy of it if you decided to move forward with this, that we have the signed copy to do it.
If I could, just clarify one thing.
Ed, can you stop?
I'm sorry.
I think she wants you to speak in the microphone.
Yeah, Ed Knatzer again. If I clarify one thing, the purchase price was $25,000, but there's closing expenses involved in that, and I hope to get a little commission out of my work. And so, but the $30,000 is based on 2 appraisals. I just want to clarify that.
I didn't realize Ed was gonna make any money on this till this morning. I'm only kidding about that. I'm sure we hired him at a normal commission for a realtor to handle this.
Can I make a comment about this? This parking lot you guys are talking about, this is a place where I have special judges park, which we need every once in a while, so you need to think about that. I don't know what you're gonna do about that situation, scenario, whatever. I'm sorry, Emily, court administrator, forgot to introduce myself. So that's the only thing I'm worried about is we have people like that, or we have judges that come out of county, and we have no parking. Our judges' parking is full, and I don't have a place to put those people. So
Well, they might have to just walk, you know.
well,
extra.
that's what I'm asking. So if you get rid of this parking lot and swap it, would you put the parking in the other
Right.
spot? How far is that?
It's, being that you're on the west side of the building doesn't help.
Excuse
because
me.
It's not that much further.
Okay.
Ed can answer again. You can look at it on the GIS, and it's within the same walking pattern as the jury lot. It's a block from 300 to 214. You can see it's just one block to the east, so geographically it's about the same amount of steps. And it's a much nicer lot. It's defined. It's striped. It has a small fence around it.
And we also gain some because I think
Absolutely.
our jury lot's only
That's
30
correct.
maybe.
Yes.
But I'm ready to make a motion and get it off the table. I would like to ask Bill though, as you are separating, will you be going down Washington Street and working at the corner of the High Street on the
Washington High Street.
southeast corner where we park to take care of that odor that,
I can't answer when we would do that, but I can find out for you, and I'll let you know.
because I know you have to go.
I'm telling you, we're pretty well gonna be digging up the entire downtown at some point in time.
We're all looking forward to that.
Yeah, I understand.
Driving downtown right now.
Yeah, I understand, and, and the real problem is when you're doing these projects, the records of what's underneath there downtown, it's not like, a traffic signal.
Right.
You get in there, and then the gas company has a line in there you're not aware of, and so you call them, and they'll say, well, sure, 2 weeks, we'll be back, and you're in the main intersection. So this is not an easy task for those people out there actually doing the
Back
work.
in the late 1800s, they didn't think about that. did they?
Yeah, I'm sure, yeah, unfortunately, it didn't. But again, I appreciate your consideration for this. And I my thoughts also were is that I could see this as, and I have no idea what the county would do in the future, but having two of those lots together are a pretty nice place for a building or something else that you may need to have in the future. Just a thought, but.
Thanks, Bill.
All right, thank you very much.
I will make a motion to accept the offer upon,
Actually, the first motion needs to be remove it from the
well,
table.
okay, I'll make a motion to remove it from the table. Getting tired of looking at it.
Second. I'll second it.
Roll call.
Ms. Reagan,
Yes,
Mr. King,
Yes.
Mr. Henry.
Yes.
and now make a motion
Now would be a
to
motion to approve.
approve transfer.
We're approving the letter of intent only.
Right, you're approving the letter of
no
intent.
transfer.
Right.
Because they still have to purchase the property and get it closed, and
Yeah.
Move letter of intent.
Do I have a second?
Second.
Roll call, please.
Mr. King,
Yes.
Ms. Reagan.
Yes,
Mr. Henry.
Yes.
Thank you.
Thank you.
thank you very much.
That would be the sanitary district board.
I'm Bob Schreier, 7110 East Centennial. Your EMS director just hit on a note that kind of perturbs me a little bit too. He was talking about the state hiring actuaries to go through all of the medical records and how it was unjust to a lot of people because the actionaries were actually paid by the percentage that they could receive from the state, from those people. Our auditor I like him very well, but he's also got a contract for the farmers for property tax that's going on. I've gone through one of these actionary meetings with one of them. I made a mistake on my taxes. I'll pay them and go on. I feel I'm right now, but I understand that they are being paid by the amount of money that they also receive from the taxpayers. So it kind of comes down the line is what I'm driving at. So, thank you.
Thanks.
Hadn't heard that.
Anyone else?
Make a motion to recess.
Second,
Roll call.
Ms. Reagan.
yes.
Mr. King.
Yes.
Mr. Henry.
Yes.